Hello, I'm Alexis Flen, and with Quinta Fernandes, Sophia McFarland, and Taylor Henderson, we created Understanding and Challenging Bias, an anti-oppression workshop for future clinicians. Through medical education, there's an emphasis on implicit bias in microaggression training in a clinical setting, within which different power dynamics exist between students and supervisors. We believe there's a need to facilitate longitudinal training in medical education before this stage. The aim of this workshop was to address the implicit biases and microaggressions in the preclinical environment in a collaborative effort with the UNC School of Medicine to eliminate incidences of interpersonal mistreatment. The sessions involved all first-year medical students and was incorporated into their virtual orientation. A literature review was conducted to assess the prevalence of mistreatment in the clinical environment and the benefits of training and reporting interventions. A pre-session module based on those findings was formulated to establish baseline understanding of important terms and assess the needs for this session via pre-survey. The session's ultimate aim was to equip students with the tools to confront their prejudices and become effective allies for those most affected by microaggressions. Prior to orientation, we provided students with an interactive module on foundational concepts and terminology relating to bias and microaggressions, prejudices, and AAMC allyship strategies, interrupt and charge 2. The module excerpt seen to my right here is the pathway of implicit bias, which was included in the module. Faculty and staff and students were facilitators in this workshop. First, we presented scenarios of microaggressions. The cases were centered on redacted recounts derived from preclinical experiences of microaggressions at UNC School of Medicine. Facilitators then modeled allyship and intervention behaviors that coincided with AAMC intervention strategies. Then students and pre-assigned facilitators were sent to virtual breakout rooms and tasked to respond to a microaggression scenario with guided discussion questions. Sessions culminated with a debrief and students' misconduct reporting options. In terms of outcomes, we collected both pre- and post-survey data to gauge baseline understanding and experiences with anti-bias training and to evaluate the impact of the workshop improving those competencies. Of the people that filled out the survey, there were 77 responses. For the first question that was asked, prior to this workshop, I had formal experiences or teaching regarding microaggressions and the mistreatment of marginalized groups. Of the students that responded, 25% said they had no previous experience. Of the students that responded, they said they felt equipped to handle isms such as racism, sexism, ableism, or any form of prejudice against a marginalized group. Of those that responded, 2.7% said they strongly agreed with that, 34% said they agreed, 46% said they somewhat agreed, 8.2% said they neither agreed nor disagreed, 6.8% said they somewhat disagreed, and 1.37% said they disagreed. In the last question of, I feel confident in advocating on behalf of patients as well as colleagues in a challenging environment, 10.9% said they strongly agreed. 52% said they somewhat agreed. 52% they said they agreed. 28.7% said they somewhat agreed. 5.4% said they neither agreed nor disagreed. And 2% said they somewhat disagreed. And then post-survey data is still being collected. In conclusion, pre-survey data conveyed that at a baseline, there was a spectrum of ability in addressing microaggressions or experiences with anti-oppression training. This communicated a need for more intensive and longitudinal guidance in preparing students to act as allies in preclinical environment. Post-survey data is still being collected. Here's our works cited. Thank you.